So you're not going to go that long tonight, right, Chief?
I promise not to go that long. In fact, I'm going to talk very little. I'm going to turn it over to the professionals here at the table. I just want to thank council again. Most of you have been over to our facility and checked it out. You've shown a real interest in what we're trying to do over there, and we're trying to do things different. We have our jail advisory group, and in fact, just the other day, Council President Coelho and I were talking about opportunities to have more council interaction with what's going on at the police department, but also with our jail advisory group. All of these people here sit on that board, along with some of our state electeds, other community stakeholders, and so it's a really neat group, and just really excited to hear them tell a little bit about what's going on in our facility right now. We're at a spot where we've been open for almost a year, and just tonight we have Everett that should be going forward with the signing of an ILA to begin housing people at our facility. I'll let you guys talk about the others, but we are Mount Lake Terrace and Mill Creek will begin housing people beginning August 1st. We had some, I would describe just some process issues. It's very complex. You start talking about not just bringing people in, but they have to be able to be seen by a judge in a timely manner. So we're navigating multiple jurisdictions and just those video court processes and making sure we have the right attorneys. We have legal representation from multiple jurisdictions at the right place at the right time so they can have connection with the people they need to connect with. The judges need to be properly apprised and ready to receive people at the right time. So it's a fairly complex operation, and we've been learning quite a bit, and we've had some great community partners, and we're excited about that. With that, I'll turn it over to the group, and they have a little PowerPoint they're going to go through, and your questions will be great and greatly appreciated as well.
Would you like to introduce your folks?
They have a really nice slide that introduces them, and I didn't want to steal their thunder. So they really do. Nice pictures, headshots, everything. So I'm gonna leave it with them.
Thanks, Chief.
Thanks, Chief. Mayor, Council, thanks for having us. We're excited to talk about what we've been doing and the work inside of our facility. If we could start the PowerPoint, I can't see if it's up, but I don't know if that's an option for us. It'll be up there soon. Okay. In the meantime, we've been incredibly busy. We have been spent the last year just learning about different processes and learning what we're able to accomplish and whatnot. And so, that's excellent. Thank you. So Joe Dickinson, I am the outgoing jail commander. I was in this position for the last 3 years. I know many of you have had conversations. We've gone through the facility, and to grab hold of Chief Nelson's at the time's idea for this facility was to do it differently, and I think we're on a really good path to do it differently. So I'm transitioning out, and I'm going to introduce Greg Curtis, who is our new jail manager.
Hi, my name is Greg Curtis, and I recently started as the jail manager here at Lynnwood. Before that, I worked for 28 years for King County Adult Detention, and I've only been here a short time, but I'm very impressed with the work that's already been done, not only from the start from Chief Langdon, Commander Dickinson, and Andrea, and Courtney here. There's just such an obvious level of caring involved in the work that going beyond just a safe and secure facility, really having impactful having a positive impact on people's lives and getting people out of being involved in the justice system. The care and the programming and the reentry work is really impressive. And for my part, I look forward to being a part of that and adding to that in the future. It was nice meeting all of you. Thank you.
Hello, my name is Courtney. I'm the Health Services Administrator and Registered Nurse, and I oversee the medical, mental health, and substance use treatment over at Lynnwood. I came on a little bit before we had opened in March of 2024, and pretty much helped build out this program alongside our team, and it's still continuing to grow. Lots of work to still do, but we're in a really great place and seeing a lot of, we're helping a lot of people and seeing great outcomes. So.
My name is Andrea Mullins. I'm the social worker, community support specialist for the jail, and so I've been here a little over a year, and it's been really exciting to see what all we can do and like what we're envisioning all together. So we're really excited.
Great, thank you. And I would be remiss if I didn't say that the people that are sitting here next to me are the ones that are directly responsible for the successes in our facility. Probably one of the, as I transition out of this role, I think that's the component that I miss the most, or going to miss the most. So really the credit goes to Andrea and Courtney and the rest of the team, especially our mental health professionals. So as we get into it, I just want to say thank you to all of you for the outstanding work this last year. So thank you. Next slide, please. And so our vision going into this was to do criminal justice differently, right? We wanted to open a facility that it was rooted in compassion and in connection, and really provide people that they don't come back to our facility. And we're going to show you how we did that here as we go to the next slide. And so this is just a recap of what we did this last year. From opening day, August of last year, it was slow progress. We took it really very intentionally. We wanted to make sure we had all of our systems in place and they were operational and working. Medical is a huge component for us. It was new. And at the time of opening, we were staffed at 57% of our allowable staffing at that time. And so it seems really high for opening a facility, but we kept our population down low, intentional, to make sure it was safe. So it was done with intent. And we had 4 student officers in training. Now we're closer. We're up in 27 range, 27 officers. And so we're gaining ground. It's still a work in progress, but staffing's improving slowly but steadily. MAT is new for us. To have a robust MAT system program, and with Courtney's team, we discovered a lot of people coming in needed a lot more help than we thought. Since we were closed for 3 years, there was just information there we didn't have. And so, Courtney, maybe you can speak to the need when people walked in and what that revealed to us. It was pretty substantial.
Yeah, we were seeing about 80 to 90% of the people that were coming in were detoxing from substances. So we were a phase 1 facility, which means that we could only continue people on substance treatment if they were already on it. But thank you guys for approving the MAT, because now we are in a place where we can actually start people on treatment, which is really big. We'll be able to capture more people and really get them connected. This is very comprehensive. It will include the medications, counseling, reentry support, and just being able to connect with them on a deeper level to walk them through that process. So we're excited about that. One thing we also learned throughout all of this is how much people it takes to be able to carry through these tasks. So we built out a care collaboration team, and that it has multiple individuals, mental health, medical, social worker, provider. Joe, he's been involved a lot in it. It takes a lot of people to try to identify those needs and carry them out, especially in the small amount of time that we have individuals. It's about a little under a week that we get to capture that and help them through trying to get them resources and everything. So we built that team, and then I learned that we needed to expand to community partners, because that was also needed when they walk outside the door. We want to do a warm handoff and ensure that there's someone that can continue the great work. So in a nutshell. Yeah, having a misdemeanor facility where it's not like a county jail. I mean, people come in, in a prison setting, they could be there for years. In county, they could be there for years. Here is much different. I mean, we have such a short period of time to figure out what's going on and how to get this person into treatment. We discovered we couldn't wait. We couldn't wait for someone to go through the booking process. Like we now had to plug that into our booking process to identify those things, which gave Andrea more time to set things up. So that if they did release, if they bailed out, or if the court says, hey, we're good, you can go, that she had everything she needed to have everything lined up. So we got into it. We created a release team email so that everyone was on the same page, and that really sped that process up. And then we started seeing our population increase, which is good, from our standpoint, because we want to help more people, but it was also, it pressure tested us as well. You ready to go to the next one? So this is kind of our process. So when someone comes in, we really want to, we start with that engagement piece. We want people to be engaged with services. And so that starts as soon as they walk through the door and what their experience is like with our officers as soon as they walk in the facility. And it really comes down to fulfilling basic human needs, right? When's the last time you had a hot meal? When's the last time you had a shower? And really speaking to that, and not just, they're here for theft or whatever. It's just
seeing the person where they are and really trying to identify their needs. So when they walk through our door, they go through a search process. They go to a medical screening, which is a brief version of the longer one later that maybe you could speak to. But we get their vitals. We want to know where their body's at and just kind of what's going on with them. It's a lot of work, right? So between the custody officers asking their questions to the nurses asking their questions to see if they're even fit to be in our facility, that's where all that happens. So do you want to speak to that?
Yeah, I just wanted to highlight that everybody's trained in trauma-informed care. So we're all able to, we meet them where they're at and have those kind of vulnerable conversations. And that throws them off a little bit because they don't expect that from a correctional facility. But I think that's how we're reimagining it, right? But this is the feedback I get from a lot of the individuals that come in. I'm going to make a joke, but I get it a lot, and everybody says that they love Lynnwood, and I'm like, well, they're going to want to come back to us because we're just that great. When they come in, the big thing is just being able to connect with them and making sure all their needs are met, and just looking at it as holistically, and then letting custody will then work through their process, and then we'll move to the connection and assessment piece. So in the intake, we'll be able to identify what the needs are. So we ask questions regarding housing, insurance, any mental health or medical needs. If they have any type of conditions that are communicable, then we follow through with that. There's laundry lists of things, but we have a team for every one of those items. And depending on what the needs are, we kind of route them to the individuals who can help. So if it's social worker, Andrea, myself, then it'd be our medical team, and then or mental health, and community partners as well. So we all collaborate together, and throughout the process, we're meeting with them and really getting into the weeds of a plan for them when they leave our facility. So
yeah, and that's kind of where the reentry preparation comes into play. We're really focused on, okay, we have other community providers in the community. We can't do everything here at Lynnwood. Who's the best fit for this person? Like, what's that next level of care look like? Mm-hmm. And calling those providers and saying, hey, do you have a bed date for this gentleman? Mm-hmm. Here are our concerns. Here's areas of opportunity for him. Is there a day we can get him there? That's Andrea's work, right? She's constantly seeking out those providers, making those connections and relationships to the point where what once took a week to accomplish, now we can accomplish it in a couple days in best case scenario. Sometimes sooner, sometimes later, just depends on the provider. But just moving on. And then transition to and reintegration, it's providing them, I think we might have had one here. Maybe we didn't bring it.
Yeah, we brought a reentry bag just to show you guys what we provide to individuals who are with us at Lynnwood. We understand that the individuals that are coming through do have a lot of barriers and don't have access to a lot of items. So when they leave our facility, we provide them with a reentry bag. Yeah, we'll do that. We'll do that quickly. We know we're on a time crunch. But a lot of individuals that come in are usually don't have clothing or are disheveled. And we believe, we don't want individuals to leave our facility in the same clothes they came in. It's just not the right thing to do. So we have clothing, donations and new clothing. We have body care items that we put in our reentry bag. We have resources. At this point, we would have, appointments that we've scheduled for them. We send them with Narcan, and we'll do education on how to use it. And we have snacks and water, a notepad and pen, sanitizer,
So we
and
put
a first aid kit.
Yeah, we put these release kits together using grant funding that we would receive from the Healthcare Authority, so that when they walked out, they had something that more than what they had when they came in, and that was just the idea behind it. A lot of times they take it with them to the next level of care, and it's just continued with them. And then eventually we hear back, and some good outcomes, some great outcomes, and some ones that we try again with. So as far as stability and growth, we continually assess our processes and look for areas of opportunity, look for new partnerships, relationships with community providers. The more the merrier, right? It takes a lot of people to get this work done.
Yeah. It takes a village.
Yeah. Next slide, please. So we wanted to put these numbers up here as a visual representation for what we've done in the last year since August to June. And as you can see, we're currently not equipped to handle in-house drug and alcohol assessments. We don't have the personnel to do that. I wish I could get it done in the first 48 hours of someone coming to our facility. It's just not feasible at this point. But Andrea did some great work and was able to find a community partner to do it for us at no cost. And so in that time, we were able to get 51 drug and alcohol assessments completed. And then the numbers on the bottom you see there, the 35% and 45%. We measure our recidivism a little differently than I think other facilities. We don't just look at our facility. We look at statewide. And so we want to know if our program reentry services are working. And the only way to do that is to know if they were booked into another facility in another county and or state, and see if they actually reoffended or if it was a warrant arrest. And Andrea did outstanding work. It's a lot to track, but it's very important. Yeah.
Councilmember
Would you like
Decker.
us to ask questions as you go?
Absolutely. Fire away.
Thank you. A great presentation so far. I'm curious if the engaged and rearrested and the not engaged and rearrested, are those cumulative? So in other words, does a percentage add to 70 or?
So that's like, no, it's not cumulative. So you have like an amount of people that were engaged, period, and then an amount of people that weren't engaged. And then 35% of the people of the chunk that did engage have been rearrested. As far as the other chunk is 45% were rearrested.
So it's really showing improvement there. What you're saying is
Yes.
that those that engage with what you're doing, and then when they engage once they're released, you're showing a 10% improvement in rearrest or a 10% decrease in rearrest versus those that don't go through a program such as this.
Correct.
Thank you. That's good to know.
Yeah, and we thought that was a holistic view of just kind of, instead of just saying, because some people have come back and we'll try again, right? We're not going to tell someone no. And so we're not working, I guess we're working against ourselves if someone comes back, but at the same time, we're going to find a new path for them.
But that's 1 in 3, basically. I mean, so 2/3 of the people that go through your facility and are engaged are not being rearrested in the state. That's actually, I'm pretty impressed by that. That's amazing.
Yeah, we know it's not a one-size-fits-all. The people that do come back, we try again and try to figure out another alternative, and that's okay. So just working together.
Councilmember Partial.
I don't want to steal your thunder if this is coming up, but I'm curious since we're talking about it now. What is that treatment engagement process like when you have someone come in and you're identifying there's a possibility here to help? How do we get them on board with this?
Yeah, so medical does a really good intake screening at the beginning, as they were talking about, and so some trigger items will come up, such as substance use issues, mental health issues, housing, all of that, and that'll get kind of routed to me, or like we'll have a conversation about it with the care collaboration team, or we also get kites, and so at that point, I would meet with the individual and kind of just have that conversation of like what. Oh, sorry, a kite.
Thank you, Chief.
Yeah, it's a message that the individual in custody can send to custody officers, me, Courtney's team, just about their needs or questions. And so I meet with them and we have that conversation, get to know more about them, where they stay, where they're wanting to go. And then at that point, the majority of people do have substance use issues, we've found, as Courtney and Joe have said. So most people need an assessment, a substance use assessment, and that's where we've partnered with Evergreen Recovery Center to provide those assessments. And then from there, I think 99% of the people have been recommended inpatient, and so we'll start setting up a bed date. And as that slide shows, 23 people have been picked up from the release door and transported to inpatient, which is pretty cool, because I even had somebody today tell me that they want to stay at Lynnwood Jail as long as possible to take advantage of all the help we can provide. So that was really kind of weird to hear, but also pretty cool. So yeah, that's kind of what that process looks like. And then as far as like case management in the community, We partner with other agencies, and so if maybe substances aren't their thing, then we can connect them with at least somebody to help with housing, other mental health stuff if it's not substance related. Does that answer?
Yeah, thank you.
I wanted to note that for the drug assessments, it's kind of unheard of because usually the drug assessments happen outside. Am I correct? So, like, yeah, court ordered, and inside a jail to have that done and set them up for treatment, you don't see that often. So we're really capturing all of it in that week. So we're really excited about being able to do that and the amount of people we've been able to get connected to inpatient because of it. So
Go to the next slide. So we just put this in here as a reference point. This isn't obviously capture everything, but the majority of people that are being arrested are for theft. And we want to have a real impact on a reduction on that. We see it as if they're getting treated and their substance use disorder is being addressed, and any mental health concerns that we're getting into those resources, that we should see a reduction. Now, I didn't pull data before and after for the last year. There's probably some factors there and some margins that don't equally come across, but it's something we're watching because we'd like to see that number obviously come down. So we can go to the next one, unless there's a question. Go ahead.
Yeah, glaring
Councilmember
question
Becker.
is, what is non-disposable or non-disclosable?
Non-disclosable. So I had to ask about that too because I didn't know, especially the non-reportable. It was all other crimes that didn't fit into the top categories in this. So there was like driving while license suspended, I believe. I can't see on there. There's it's basically what's not listed in that category itself. Driving offenses, there were...
So non-reportable just means non-reportable in the chart, not that
We're required,
Yeah.
as part of the state, we're required to participate in NIBRS, National Incident-Based Reporting System, through FBI. So they're very specific because they want apples-to-apples comparison across the nation on crime as opposed to different types. So we have certain crimes that are passing by ordinance here that we will arrest people for, or they'll be charged for a crime with, that when FBI doesn't want to hear about it. So they just put those all in the bucket of non-reportable. So those are ones that go in there that are then put into that bucket. And we can break that down and disaggregate that a little bit. But
Thanks, Chief.
Thank you.
And so implementation plan for the 1115 waiver. We've talked about the 1115 waiver. It's been a minute. So I wanted to, I told that whole front story just to get to kind of where we're headed. The 1115 waiver, when people come into our facility, their benefits are suspended. So they don't have medical coverage. And then the city of Lynnwood is on the hook to pay all medical bills. This waiver, the 1115 waiver, we are the second state to participate in, the first one being California. They're still sorting things out in California for how it's going. There's not any really good statistical data coming out of there yet, but it does afford us the opportunity to bill to the 5 MCOs and or Medicaid for some of the medical treatment that we're providing. So this includes drug and alcohol assessments, the medication itself. Help me out, Courtney. There's a whole bunch.
Pretty much anything. And if they're getting therapy groups, medication, reentry needs, it really covers a good majority of the care that we're providing. But I even wanted to highlight how much it's going to expand resources in the community, because that's a struggle for a lot of people who are incarcerated right now, is that being able to utilize community partners or get care at the emergency room or anything like that, it comes at the expense of the facility. But now with the 1115 waiver, we can actually use community providers and get the help that we need without putting a ton of strain on, not strain, that's a wrong word, but just being able to build our team and make it larger and getting more care for the people who are at Lynnwood. So we're excited for that.
Yeah, this is what we want to complete within this year. We're not waiting. We were in the first cohort in the state to participate. We are pushed to a November 1st start date where we can go live. And the big component of that was Matt. So again, thank you, because that is our medicated assisted treatment program is a major part of that, as well as our reentry support. So this comes down to case management. With the 1115 waiver, we can go to the next slide. Sorry. Oh, go ahead.
Who do we thank for this 1115 Medicaid waiver? Is it something that only we got, or was it something across the state, or how did we get this waiver?
Yeah, so the state of Washington applied, I believe it's to the federal government for this waiver, and it was approved. And so I'd have to do some research to find the key players behind it, but.
No, I was just wondering if it was us specifically or a broader thing, but I didn't even know that was a thing. So if someone was like a diabetic and committed a crime, it was just donezo before the waiver? Okay, thank you for educating me. I was just curious if like somebody had applied for a grant and now Lynnwood has this Medicaid waiver. I'm like, who do we need to give kudos to here? Because that's insane.
Yeah.
So that's why I was asking. Thank you.
Yeah, we did have there are cohorts, so we did have to work through the process of getting there, but we're there.
Yeah, there is milestones to this process with the 1115 waiver. It's not easy to navigate, but it requires a lot of help, to speak to medical terms that I'm just not familiar with. So,
And Joe, I'll just add really quick, the Healthcare Authority also provides with funding to support the spin-up of this process. It's significant. The administrative burden here is significant in the spin-up, and so a lot of other entities are sitting back and watching. So the fact that we dove in was because we had confidence in a team that was willing to dive into this. Even in California, many are still sitting on the sidelines because they're not sure what this means. And if you talk to providers in Washington State, even outside of the jail, they're like, yeah, we're not sure what this 1115 waiver means. But the Healthcare Authority has been a great partner so far. They've walked alongside us. They understand the complexities here, and so it's been a good partnership with the state up to this point. So we're deeply appreciative for it, and the spin-up that would otherwise been borne by Lynnwood has been borne through state funding. So.
Yeah, thanks, Chief. So this is just an overview of the Medicaid waiver itself and how it allows us to utilize Medicaid in a fashion to help offset some of the medical costs, right? So I don't think there's anything else on there that I wanted to touch on, but we can go to the next slide. So there are some requirements, right, from the Healthcare Authority that we have to follow, right? So some of those requirements say that we have to provide 30 days of medication at release. We have to start pre-release services 90 days before they're released. All of which we're prepared to move forward on, and with that comes medication that we've never seen before that's being implemented that allows us to, if somebody wants an injectable for detox, my brief understanding is that they can take this injectable, they can walk out the door and they're good for 30 days. They won't go through withdrawals, and on top of that, they should not be able to have the ability to overdose, and that's incredibly powerful for individuals that want to get that help. And so we continue to look at it. So it's the other side of it is with our population increasing, the work becomes more demanding, and it's the more work that's there, it's hard to provide that individual care to folks. So we're just trying to figure out better mechanisms. Some of that includes software for case management, so that Andrea can enter someone into a program that all of the providers can see, and there's visibility. So. Did you want to speak to in that specifically, Andrea?
I can. Excuse me. So the software is you can conduct like assessments on it, and then it kind of creates a treatment pathway and explains like, oh, this person based on this needs this, and then we're going to be able to customize it to where we can put community providers in there, and so it will be able to pair this specific individual with this specific organization because that organization meets this specific individual's needs. So it's going to be really individualized, targeted programming the kind of possibilities are endless on, what community providers, what programming. We can put classes on there, like DUI classes, anger management, for them to take. So we're really excited to get that rolling out too.
Yeah, it's definitely a force multiplier. Go ahead. Oh, sorry.
Councilmember Escamilla.
Thank you for answering that. It wasn't clear if it was just like FYI, if we were using it now or we're going to apply for it, and if we did, I wanted to. But do we have like memorandums of understandings or anything like that, like kind of like the school districts with your community partners and nonprofits, or is that something that you guys are kind of always open to, or how does it work for you guys with your partners in implementing these things?
So I'll use a specific example. Like WellPath already had a memo of understanding between another community provider. I believe it's Acadia. And so they were able to just make if we needed methadone for a client, it got delivered. And so there was really not a whole lot of things to accomplish in that regard. Other times it's Courtney found a provider that was in the community that provides mental health treatment. And so it's a MOU between them and our services, and they do it all telehealth. And so they're able to do it actually within the facility without being in the facility, and it's been pretty smooth so far.
So that's what you guys use. And do you always have one, or only sometimes depending on, like, I guess, a contract or the need?
It's really needs-based.
Needs-based?
Yeah.
Okay.
So.
Which is good.
Yeah. If we see a gap, we're just going to try to figure out, we're going to find help.
Rather
So
than
we'll-
be limited to only these 5 that we have in memorandum.
Exactly.
And that's
We're very open. Yeah.
Yeah, this group, when they encounter a problem and they don't know the path, they will search tirelessly to find a path to yes and find a solution.
Someone has to do it, correct?
Thank you.
I notice you have a couple more slides on 1115, but I've also got questions. Do you want to finish explaining 1115?
We can go into questions, absolutely.
Okay. Councilmember Lutweiler.
Thank you. My question was maybe more, I'm just thinking with all the Medicaid cuts that are happening, I don't know where this would land, and I'm not expecting you to, break out a crystal ball, but I thought maybe on the city staff side or like with our lobbyists, like if we have someone that could maybe try to get ahead of, do we think this might be part of the upcoming cuts or just maybe something we'll just have to keep an eye on? That was my only comment so far. And thank you, council member. That was my concern as well, and so I reached out to the HCA to ask for clarification, and we are good. This 1115 program is good till 2028, when the state would then need to reapply for it. So while there is an end date to it, we are in the time we have now. I want to use the time we have now and maximize those efforts. So,
all right, Councilmember Hurst.
Thank you. Just before we leave this slide, so our average day is 6.8 days. But that's really not enough to detox from fentanyl at all, from what I understand. But we do have MAT. So when we hand them, if they do leave, then we are providing them 30 days of service or a 30-day shot. I heard a shot or injection. Then do we somehow, and with Acadia just up the street, are we able to bring some of those people to Acadia? How does?
So it would be anyone in our care that we would be able to provide either a 30-day supply of medication or injectable that covers 30 days. We are supposed to have an appointment scheduled for them. So when they leave, there's something set in stone. Now with Acadia, if they have individuals that are not in our facility, it doesn't go like both. Like their individuals wouldn't come to us. But anybody who is in our care that is wanting to continue methadone or get started, we can use Acadia to have them get that, because we're not an OTP facility. That's the one thing we're not able to provide is methadone, but we can connect them to the right people who can and continue them on it, and we'll do the dosing so long as someone is able to bring the medication. So.
Great, thank you.
All right, back to you.
All right, we can go to the next slide. And so this is just a visual representation, a poor one that I made. I apologize. It's just trying to learn Medicaid billing from my perspective was a challenge. So here's a visual representation of how I understand it. So the Healthcare Authority manages our managed care organizations, or MCOs, and there are 5 of them in the state. And they each provide, by RCW, by law, are required to provide services to our facility. And we have a great partnership with our MCOs. They're helping us out. So that when people come into the LCJC, our facility, and we provide a medical service to a client, we can recoup those costs, and we will partner eventually with a billing agency that will handle our Medicaid billing. They can see right into the core EMR system that our medical team uses, is able to pull that data and then send it to either Apple, which is a state program for Medicaid, or to one of the MCOs, depending on the client's coverage. I made the mistake of going online and looking at all of the codes for all of the medical services. It is a lot, and so it was overwhelming. So I tried to print it, and I had to cancel because it was too large. So, but that's any services that are provided. The information from core EMR goes right to the billing administrator, who then submits it to Medicaid and or the MCOs. The MCOs or Medicaid then would evaluate the claim and reimburse. So that's a very basic flow of the information and how the billing works.
Joe, I'll just add on this. A big question we had is, what does the cost recapture look like if we're billing for services? And so that's where we've been trying to talk to our California peers, the carceral facilities down there, and there is very little data coming back up to this point. So WellPath has a couple facilities down there. So we're not sure how long it takes before this engine gets up and running and becomes somewhat self-sustaining, or at least creates a significant offset. We've heard it could be as high as 70% cost recovery. We've heard others say it's only about 15, 20. So we just don't have solid data yet. Clearly, HCA believes in this enough that they are funding us about $2.2 million to make sure we get the system up and running. But in terms of what it looks like once it's up and running and that cost recovery, we're not quite clear on that yet. So, and that was part of where we've seen others hanging out on the side. The work needs to be done regardless, so we see this as a low risk, and any cost recapture is a plus for us. So, and that money comes back to the city.
All right.
All right, next slide. So, the community effects are pretty obvious in this. It reduces repeat incarceration, improves public safety, and things of that nature. But really, we want people to come in and get better, be better versions of themselves when they're released. This also leverages state and federal Medicaid for funding, which is a good thing for us, and just provides overall better care for those that are in our facility. So. We try to be proactive, which is really hard to do in a facility like ours, but this is our way to do that. And I appreciate it. I think that's is that the last slide? Nope. What we need. Yeah, so obviously continued support. We appreciate the support we received thus far. It's instrumental in what we're trying to do in this facility, and we're really trying to do something different and keep asking the questions. I'm watching the data coming out of California. Actually, Greg will be watching the data coming out of California. But we're all taking a look because we're just curious. What does this look like for us in the future? And that was kind of the drive to be in the front of the pack going into this program. We wanted to be on the cutting edge of something. And we recognize such a strong need to do something different. So I very much appreciate your time, and really thank you for having us. So I think that one was the last slide. Thank you. There.
All right. Other questions? Councilmember Decker?
Just a question, Commander Dickinson, you're not leaving us, you're just changing roles?
Correct, yeah. I'm moving to the Criminal Investigations Division.
Thank you. I don't have to scold Chief Langdon for. Thank you.
Councilmember Coelho?
Thank you, Mayor. Thank you for the great presentation, guys. It's been really incredible watching this whole project move along. I've talked to multiple police chiefs over the years, and each one of them said we want to redefine what it means to have a jail. And seeing the reduction in recidivism rates amongst those who are engaging with these systems, I think really speaks for itself. That's really incredible. I think Councilmember Lutweiler talked about Medicaid, so we got that already handled. But I was wondering, actually, no, we have everything answered. Good job. Thanks.
All right, Councilmember Hurst.
Great, thank you. So could we get an update on how staffing levels are now?
We are currently at 27 right now. We have someone lateraling out of state, so that drops down to 26. And then we have another second one latering out of state that's going to be closer to family. And so those are the two departures we have coming. We have 2 currently in the pipeline in the hiring process. And we have 1 graduating the academy next week.
And how many do we need for full staffing?
Full staffing is 31, if I'm not mistaken, Chief. That's at the end of 26. Yeah, 31 to 26. 31? 28 now.
And the ILAs that have been signed so far?
ILAs signed so far, City of Mount Lake Terrace, City of Mill Creek, and Lake Forest Park are all signed. The one active right now is Lake Forest Park, with Mill Creek and Mount Lake Terrace starting on August 1st.
And it's still in their court.
Yeah, Edmonds, still in their court.
Did you say something about Everett? Was I not hearing right?
Everett's bringing the ILA forward to council tonight, so it should be happening right now as we speak. So, and their target is to begin housing people August 1st. So,
do we get all their people?
We could not accommodate all their
no.
people. So they're looking. Part of the discussion we're having is, do they want to bring in fresh bookings from people who are arrested out in the field? They also have their folks that are there on 30-day holds. They have that 3 strikes law or 3 strikes ordinance, and so they're looking at. I believe it was them, but they're looking at their longer term, so their 30-day and more holds. We're a better option for them, and the service provision is something that they're very attracted by. But we could not accommodate all their work.
Yeah, so. Right. And has the jail lieutenant position been filled?
I interviewed the candidate last week, and we'll be making an announcement next week. So I don't want to ruin the surprise, but yes, we're moving on that right now. Yes.
Okay. And then
that will take us down. If we were to go with the person, that would take us down another body because that would be an internal. So the staffing. It's not 27. It's closer to. We have a person down the academy right now. We're closer to operational. We have 2 down the academy, so we're operational. We're down 22, 23 right now for 24/7 operation, where we have minimum staffing levels. It's a constant stressor. We just moved to a spot where we had the police officers move out of staffing the control room because the MOUs that we have in place were expensive and it was not sustainable. There's a potential of us having to explore that and talk with the union about reinstituting that if our staffing levels go down, just so we can stay open. So staffing a jail is incredibly stressful because you have levels you have to be at, and then they have vacation, sick time, everything else. So ideally, in ideal conditions, you have a 25% vacancy rate, meaning people are off for training, sick, vacation, whatever it might be, extended leave for family, for PFML. So it's a real thing. So, and I tell you, the medical staff feels the same thing in their world. It's just there's just this stress on staffing right now. So it's something we're constantly managing, and it is what it is.
Do you have a timeline for fully operation for the jail? Is it 26 then we're looking at?
You mean if we have 26 people working?
No, in 2026. I mean,
yeah.
When are we going to have everything going?
We're close.
Okay.
So I mean, we're close. A lot of this has been working out our processes and ILAs and working with folks, but even just bringing someone in and understanding how that married up with the medical assessment that needed to be done, how they were seen for court the following day, having lower numbers, we built in a lot of efficiency. And so if you talk about someone like Everett, if they bring people down there that are there for sentencing, where they don't require as much movement in the facility for court hearings, and other processes, once they've been stabilized, once they've been trained for medical, and they are receiving resources and or connected with resources, that's a fairly stable population in terms of workload. When people are first coming in, they're in crisis, they're coming out, that is labor intensive. The front half of people coming in off the street, and it takes a little bit of time, just that physiological process of de-escalating, that's labor intensive and that's staff intensive. And it's also a very dangerous time for not only the person but for our staff. And so that's where we really, that front half, when you have people that have been in for a bit and they're just doing their time, different mindset, and it's just a different dynamic. So, right. So I'd say it's staffing dependent, but we're at a spot where real cost recovery starts to happen for the facility in August. So
okay, and then just question off the wall.
Yeah.
Is Marysville Jail operational? Are they?
They're operational.
Open?
They have the similar staffing stressors that we have. Custody staff is it's very challenging, very competitive, and so we've had people come from other facilities in the area, but got to be careful with that. So yes, they are stressed as well. They do not contract out except to Lake Stevens.
Okay, thank you. Appreciate it.
All right, Councilmember Purcell.
Thank you, Mayor. First of all, I want to really salute the innovation. I think when people were questioning the need for a new CJC, this is exactly the kind of thing that we were hoping to see for the community: increased safety, increased services, making a difference, working to break the cycle for people. And this is just tremendous to hear about. I'm so glad to have all of you here today in front of us. I want to kind of officially welcome our new jail manager, Greg Curtis, I don't know that we've had the chance to officially welcome you here at the council chambers before. How's it going? How's the onboarding going? How's the handoff going from Commander Dickinson?
No, it's been great so far. I'm excited to be here. Commander Dickinson has been a fantastic resource. I can only hope to get to his level of competence and expertise. That's my goal. So, so far, no complaints. It's been great.
Excellent. I just want to give you a chance to chime in because we didn't get to hear from you yet. Andrea, I wanted to talk to you because I was at the courthouse last month and at a stakeholder meeting with the judge, and people kept going, do you know Andrea? Andrea is amazing. She works in the jail, and she does fantastic things. We wish we had an Andrea. So people were saying very nice things about you at the courthouse and what you're doing over there as a social worker. So when I hear really good compliments about people, I just want to pass them along. So the word of mouth is that you are doing amazing work in our Lynnwood Jail. So thank you for that.
Good. Yeah.
Courtney, I was curious a little more detail about what your days are like. Can you maybe take us through some of the, not necessarily what an average day is like, but what are the things you're like handling the most over there? What are you running into? Just curious.
Yeah, that's a loaded question.
I know it is. I'm
It
sorry.
is,
I
but no, I'm
didn't
happy
mean
to
for it to be
answer that.
loaded.
No,
I'm
no,
just
no, you're
genuinely
good.
curious.
You never know what to expect every day. Between trying to open the MAP program, the 1115 waiver, all adding those into a new facility where you're still kind of figuring out your policies and procedures, and it's challenging. And I'm a registered nurse as well, so I'll fill in on the floor when we don't have nurses. But yeah, day to day looks different, and that's because we're trying to. You don't know what you're gonna get. If we're gonna have a release and it's not safe, then we're kind of doing that case management, making sure that that person, when they walk out the door, they're not going back to the streets, that they have somewhere to go, a plan for care. So there's case management. It's operations, building programs. I don't know. I feel like I wear just different hats. We all kind of work together and just support each other. Whatever it is, like if I'm out for a day, she'll help support me and vice versa. So our care collaboration team, we work closely together in that way. I don't know. What do you think? What do I do on a day-to-day?
Well, I definitely didn't want to ask it like that. I don't want it to come out sounding like, geez,
no,
what are
you're
you
good.
doing with jail? No, I'm definitely not asking that way. And I was hesitant to say, what's your average day like? Because I think I fully understand what you're saying.
Yeah.
Like, you don't have average days.
No, that doesn't exist. But I like that. I live in chaos and figuring out things. And I love what we're doing and the people that we get to help, and hearing the feedback is wonderful, and I'm just always asking questions and trying to find ways to improve. I've worked in corrections previously, and seeing somebody walk out the door and not talking them through it, or planting that seed, or trying to work them through that process, and seeing them come back just didn't feel right to me. So being here and being able to be in a position where I can collaborate and make larger decisions for our facility is very exciting. But yeah, our day-to-day is very different. I just plug in everywhere where I can.
Well, thank you for the quick overview. I definitely look forward to learning more. And maybe just a question for everyone. I don't know who can answer this. I'm curious, and I know you don't want to speak for the courts or Judge Befew, but I'm curious, does this give some sentencing options to us in Lynnwood? Like, if that treatment is available, is the judge able to say, hey, if you work with Andrea and Courtney over at the jail, we can do this for you?
Great question. We have a great relationship with the court, prosecutors, and defense attorneys. And so oftentimes Andrea already has a good plan going forward and relays it to the team on the court side, and we find a path. Yeah. And so a lot of that coordination, and the reason I think we've had some really good success stories come out of this is the work that this team's been doing with the court in collaboration for the best interest of the individual and of everyone, right? So I think that's where that kind of magic happens, is that collaboration between both court and jail.
Well, thank you for elaborating on that, Commander Dickinson. And thank you, everyone, for all you do. Thank you for being here today. Really, really great stuff. Thank you.
Councilmember Lutweiler.
Thank you. On slide 13, you mentioned a goal to seek sustainable funding. So I'm just curious at a high level, like how much of the budget is coming from these potentially not sustainable sources, and that might be a question to take away, but just with, again, all the grants being ended and money being yanked back, I'm just wondering, like, what is that potential hole in your budget that we should understand? Like, all this great work could potentially come to a stop unless we have some kind of, backup. So just, curious to get your thoughts on that.
A great question. Just follow up to your first question earlier about keeping an eye on this. We had a conversation with HCA as soon as there was administrative change, and there was talk of we're going to tear apart and reimagine Medicaid. That perked us up because we were really diving into this 1115 program. We had invested over a year of just trying to get ready for it. So there was a lot of time spent. They did not anticipate anything, and we've been told it's safeguarded, but we're in a time right now where we don't know that to be the case. I mean, we believe that to be the case, but we don't know that to be the case. So we will continue to monitor. In terms of sustainability, the whole idea of the 1115 waiver program is after they give you the seed money, they're hoping that becomes self-sustaining. But we start looking at, is this a cost that needs to be shared by our partner agencies that are bringing their people here? Is this something, we recognize the grants, but the whole idea is that the 1115 waiver program is supposed to provide a significant cost offset. We just don't know what that looks like yet. And so we're not sure if that's 70%, 80%. I have a hard time believing it's 100%, but it is something we're watching. But their understanding, their selling point on this is as you get on board with this, we're taking those costs away from you as a carceral facility and putting that back to where it belongs, which is with the MCOs and or the healthcare authority. So, but it is something we are monitoring, and we just, until we actually know for sure what this looks like, we're watching it closely. But it couldn't have hit at a better time, though, in terms of all the things that we're trying to do, because this is all about how do we get these people focused on reentry and set them up for success as they go back out there. So it's a beautiful model. What they're trying to work on is what we're all about. So this program came about. We didn't know about this when we broke ground on our facility. So now to have this hit, to hear about it, to dive in and commit to the process has been significant for us. Before that, we were just carrying the costs of medical here at Lynnwood.
Yeah, so I guess I'm thinking just kind of broadly with all of the work that we're trying to kick off, or even like the MAT that we just funded through the opioid funds, right? So that's another like one-off source of money potentially. So just not specific just to Medicaid, but just in general, that like a sustainable funding to me would be like property tax, which is somewhat steady. Sales tax is somewhat steady. All those grants and other finite sources of money, I just don't know how much of the budget are we relying on. So again, not that I'm expecting all the numbers today, but certainly I think it's probably on a lot of our minds is just wanting to understand how much of that is at risk, and what creativity and what brainstorming can we try to be doing
right
on giving you that sustainable funding if the only party willing to commit is the city. So just very curious at some point to get more
Great questions. I can tell you just off the top right here, what we pay for medical right now is about $3.6 million over a biennium. So, and you add in Matt, that's another, what was that, 7?
Oh, yeah.
No, 4.
Total.
7.
Biennium.
So, yeah, so it's over $4 million over a biennium that we're looking at right now, and that cost will only go up if we don't have the Medicaid waiver program to help out with that offset. So that's where it is, and I could get you better numbers than that, but that's accurate.
We've also, thanks, Chief, and we've also been very intentional too, right, of not using the funds appropriately so that we have scalable services through our community providers, and saying if that funding for this particular thing falls off, okay, we throttle down on that. So right, just to stay in alignment with our available budget.
All right, Councilmember Escamilla.
Thank you, guys. I'm really impressed. I mean, in 1 year, and this is exactly what I think the community needs to hear to ease the fears and the perception of our new jail that nobody asked them about that was just going to get filled with Lynnwood people. And even if, unfortunately, that was the case, we are doing exactly what your motto says and leading and treating with compassion. And I didn't go to last month's, but several stakeholder meetings. So to hear how it's kind of all come to fruition, just major kudos. I noticed that you were the new jail manager and we had not met you before, so I too was going to welcome you. And my question to you, Chief, is how many inmates do we have right now, and how many have we had like at our highest point so far?
I'll turn that over to them. I ask that question weekly, and it changes all the time. So
Yeah, currently at 35. Our high end, it was 48 at one point. I don't think we went over that, but we're currently today was 35.
Okay.
And we're an 88-bed facility. So.
Okay, so still have room, but we're just about to get all these contracts in, so it will likely, we'll be getting there.
Correct.
My other question is, and thank you, Councilman Lutweiler, for kind of breaking the ice about property tax, but it should be noted that I believe we funded with the property tax increase 3 of 5 positions that you have had requested during budget season, correct?
So for the custody staff, we had a jail lieutenant. That was in the budget built in. We then asked for 3. We asked for 4, but recognizing we had to be responsible. Second half of the biennium. So the second half of 26, we received funding for those additional three folks. So where we are right now, if we hit a hiring bonanza, I'm going to push through because I have salary savings on the backside with the vacancies that we've been experiencing all the way through, just recognizing how hard it is to get folks. So right now where we're at is if we have people that are viable and can pass our screening process, we're moving forward. But it's a couple steps forward, a couple steps back, and that's just the nature of the work. You lose 3 to 5 people a year. And so it's a thing. But we did receive funding for the second half of the biennium, and at that point it was so far down the road of the hiring, and it's been Herculean efforts on the part of our hiring staff.
And I think we knew that it was going to be dependent on how many inmates that we had, and that we likely wouldn't need all of the positions, which is why we only funded part of the positions. So from the ones that we funded from the property tax increase, how many of those are filled right now?
So,
because I think it was the jail manager and the jail lieutenant. Are they all full now?
So jail manager was a movement internal. There was no additional on that. There was a difference in cost, but there was no additional. We ended up moving a sergeant out, and that is a sergeant rank that we held. No positions have been filled. It would be those 3 for the second half of the biennium, and then the jail lieutenant is the only spot that I guess would have been put in there. And how it was tied in with property tax increase, I'm not sure.
I'd have to go back, but I was just curious because if we had hired them and are utilizing them, it's important for people to know, hey, this is what you paid for. Look at the good that's happening. Right. And even then, they're approved and they're funded, and that's the direction that we're going in. And so I was just curious where we're at on what was already approved and earmarked, and letting people know that, hey, that's already there, understanding that staffing is really rough out there for a lot of industries everywhere. Just FYI. Thank you, guys. Thank you.
All right. And I'll just add my thanks. I do hear from people in my volunteer time that they love the Lynnwood Jail. And I tell them they need to stay out of jail. But I remember coming on in 2018 and going with then Chief Davis and DC Nelson and talking with agencies about, we've got a dream. We've got a dream of no recidivism. We've got a dream that people are going to be cared for, that people are going to have their needs met. And it takes time for dreams to come true. And we've had a few things to overcome in the last 7 years, but thank you for being here and giving us a great report on how it's working.
Thank you, Mayor, and thank you, Council, for your continued support. Appreciate it.
Yeah.
I'll just end to remind there is an invite. Swing by whenever you want. come check out the facility whenever you want. So just don't bring weapons in. So.
All right, next on